Glaucoma. We've all heard about it, an ocular condition that could potentially take your sight if left untreated. But as dangerous as it sounds, is it? If found, is it a death sentence for your eyes? What are the causes and symptoms? And more importantly, what can we do to treat it? Well, to answer all of those questions and more, we paid a visit to Dr. Shannon DaSilva, optometrist of DaSilva's Optical, and she gave us all of the answers we were looking for.
All right, so quickly, simple question. What is glaucoma?
Glaucoma is a name given to a group of eye conditions that cause damage to the optic nerve, which is at the back of the eye. Glaucoma has different types. So if we're going to talk about glaucoma, we're going to talk about the types, which would be open angle, closed angle, congenital, born with it from birth, and low tension glaucoma, which is the four types that we'd be looking for. If we think about the eyeball and think about the eyeball as a ball, anything that's a ball needs pressure to keep it in that shape.
Oh, really?
Yeah, so basketball needs air in the ball for the ball to stay inflated, a football as well. If you take the air out, it collapses, right? So all eyeballs in all animals, not just humans, it has a jelly in there. And that jelly there has to be a certain quantity of it in our eye to keep the ball within a certain amount of pressure, like tire pressure. If your air tire is low, you have a flat tire. So we need the right amount of pressure in your eye, not too much, but also not too little.
So what are some symptoms of glaucoma a person should recognize if they possibly have?
That's a really good question. So glaucoma is known as being an asymptomatic eye condition, which means it has no symptoms. So you could have glaucoma and not know anything. I find most glaucoma patients are sensitive to light. They talk about a sharp pain at the back of the eye with bright light. You being extra sensitive to light does not mean you have glaucoma, I should say that. And I think this is why we say it's asymptomatic.
So what can cause glaucoma?
So glaucoma is mostly hereditary. So if you have a family member with glaucoma, this puts you at higher risk immediately. So if you have one member in the family with glaucoma, your risk goes up 50% that you probably have glaucoma that can develop or you have it at the time. So we encourage highly patients who have family members with it, grandparents, an uncle, an aunt, to get their eyes checked regularly because there's a good chance that you could have it.
You mentioned that it is hereditary, right? Mm-hmm. So there's not much you could control there.
Unfortunately,
right?
No.
Yeah, so yeah. I guess there is no way a person can prevent from getting glaucoma in the first place. Nothing
That's
a person
correct.
could do.
That goes for me as well because I have glaucoma in my family.
All right.
So I can develop glaucoma.
All right. Mm-hmm. So it's just luck and chance and a genetic lottery, I guess.
Pretty much.
Pretty much.
Yeah.
So if diagnosed with glaucoma, what's the next course of action? What are the treatment options, if any?
So if you're diagnosed with glaucoma, your treatment options are mostly ophthalmic drops, eye drops. Drops that are used on various parts of the eye to reduce the eye pressure, to either better the drainage within the system of the eye, or to lower or raise the eye pressure within the eye. If all of this doesn't work, many ophthalmologists, eye surgeons then decide to do surgery to get the drainage and the eye pressure under control. It's just
so
managed.
There is no cure.
There isn't a cure, but there's management.
There's management.
And if you're a good patient and you're going to, your eye specialist and they're managing you properly, then glaucoma. I have lots of patients with glaucoma. Luckily, they still have 20/20 vision. They can see, they can read the smallest print. And this is because we're managing the condition. You don't know you have glaucoma when you have it. So it's not something that you should play around with. It's something that you should be proactive about. So raising awareness on an eye condition like glaucoma, I think, is very important. So you don't find out that you have glaucoma too late. So, and again, because you have no symptoms, you could very well be in your car driving, you think that you have perfect vision, because you can see up the road and read the license plates, not knowing that you have a relative with glaucoma who maybe have passed on and you didn't know their eye history, and so you may have it. So it's a good thing to just get checked. We'll give you good news, hopefully, and then you'll be on your way.